welcome to the Mental Margarita Show. Dr. Raj Singh is with us today. How are you, Dr. Singh?
Hey, I'm doing good. Thank you for having me on the show.
Now, Dr. Singh, you're a nationally known and a favorite doctor serving right here in Las Vegas, graduate of UNLV School of Medicine. We're so excited to have a local alumni, and then you did your specialty work, University of Kansas. And you are the founder and director of Healor, Healor, for people that are going to be seeing that and checking you out. So we're really excited to have you on the show, and you're going to share some wonderful things with us about our health. But let's go back to the beginning. How did this journey into medicine begin?
Kind of grew up in India. Again, my father kind of pushed me into med school. That was not my original path. But once I got in, I really enjoyed the complexity of medicine, and that's from there. And then I came to the US to did my residency in internal medicine. Then went to University of Kansas to be a specialist in kidney diseases. I was practicing for almost like 15 years, but I was not in the best possible health, I could say. Was burned out, drinking a lot of coffee, drinking alcohol. And then I started making some changes to my health, and I said, this is not okay. I gotta make some changes. So started like taking some experiments, some nutraceuticals, some supplements, IV nutrition, hormone optimization, and I had a huge improvement in my personal life, my professional life, the way I look, and the way I feel. And then everybody around asked me, hey, what are you doing? So I thought, hey, that'll be a good idea. Maybe a lot of other people need the same help. So that's why we started Healor. So we combined sort of a traditional medicine. We also combined some of the alternative medicine. And that's how our journey started back in 2017. And it's been a good success. I was going to say the traditional medicine, is just like, when I went to see doctors, they just want to push a lot of prescriptions. Then you see some naturopaths and like people who do alternative medicine, then they just push a bunch of supplements. I just didn't like either of those approach, and then I just wanted to have a blend of both things, and so like we gotta make my own approach, and I think that has been more successful for me than just hey that side is too bad or that side is good. I think it's a combination of treatments work the best.
And so you add in the holistic side to
Yes.
your treatment, and you also have a line of supplements too that people can access through your website, and we'll make sure that the audience can see that and can access you that way as well.
Yes, I mean
And
I'm very strict on what we the supplements we are what we take. So there are so many supplements available out there, but the quality of some of those is just not very good. And then we make sure that our supplements are made here in the US and they're the best possible quality that can be. Because if you're not taking something which is good, I mean your health is not going to improve. It's just that simple as that. So I decided to that we need all deserve to have a good quality supplement. So that's why we invested in those.
I'm a big believer in supplements and their ability to heal the body. Shilajit, zinc, boron, NAD, they can all help rescue the adrenal glands and help stimulate the secretion. So definitely something to consider. I like to try everything else before I put somebody on lifelong testosterone therapy. I will also monitor IGF levels in many of these patients because that's an indirect marker of growth hormone secretion.
At the Healor Shop, we strive to create a healthier world by providing innovative, high-quality supplements that enhance well-being and empower our customers to live vibrant, fulfilling lives. We have achieved this by using clinically proven formulas, superior ingredient quality, stringent purity standards, enhanced bioavailability, and sustainable sourcing practices. You deserve to feel your best at any age. Visit healorshop.com or scan the QR code to shop now.
don't be quick to buy that bottle off the internet. That's a good deal. Always get from a trusted source. And Dr. Singh, you're definitely a reliable and trusted source. You've been in this business a very long time of taking care of people, healing people. And you offer a lot of different services, from anti-aging medicine, weight management, the nutritional side, which we're talking about a little bit, sexual health optimization, bioidentical hormone replacement therapy. We're going to go into a little more detail about that, but you cover a real broad range of treatment from primary care, and people come to you for a lot of different
Yeah, I
things.
treat the person as a whole. So if someone is not feeling good, they possibly are overweight, their sleep is disturbed, and their sex life is not good. So they all kind of go hand in hand to me. So I don't treat like, one symptom and says, okay, go see somebody else for this. So to me, we try to focus on the core problems. And then once we fix the core problem or the root cause, generally all the symptoms get better. So I'm very interested in like, making sure my patients have, a lot of energy without relying on coffee, supplements, smoking, all of those supplements or stimulants. And then of course, that they're sleeping well, they're energized when they wake up in the morning, they have, they're maintaining muscle mass, they have amazing sex drive. So all of those things kind of go together. And again, like I was saying, when we combine the right amount of medications, the proper hormone balancing, the right amount of nutrition, just things just kind of align properly.
What are some symptoms that people might be experiencing that might indicate there's an imbalance somewhere?
Yeah, I mean, there are like a lot of symptoms. Some of them are fairly subtle. A lot of the time, generally, we're not really aware of like how our behavior is. It's generally the other person that notice that there's something wrong or something has changed about our behavior. Because these changes happens just so slowly over years. We just think like, okay, this is part of the aging process. And then again, like I said, we're not a very good judge of our own behavior. But generally, like, when the hormones are like out of balance, people have trouble sleeping, the sex drive is disturbed, can be very emotional, can be tearful. For when it comes to men and women, the symptoms do vary a little bit. So for men, of course, again, men can be more irritable. They're not as much fun to be around. They're not interested in sexual activity, losing muscle mass, lack of motivation, weight gain, especially around the belly. So those are some of the symptoms that happen, especially in men. And in women, it can again be like, hot flashes, menstrual irregularities, a lot of vaginal dryness, incontinence of urine. So the pain during sex, those are some of the symptoms we experience. And of course, a lot of behavioral issues, a lot of irritation, a lot of irritability, just not happy, anxiety and depression, those type of things do happen. So a lot of different symptoms. And we ask for all of those things in order to figure out, okay, what hormone is affected and how we can balance them for the best results.
What are some of the what hormone therapy is the most common that you find helpful to kind of get people on track? Is there certain things that are work better than others that you found?
So a lot of it actually depends on age, and then of course what the symptoms are. But for generally men, the most common thing we see is of course low testosterone. We live in such a polluted world. Our food is not the best, and we are living increasingly stressful lives, and we're constantly in a stress and a fight response. So naturally, our body does not prioritize the sex hormones, but it prioritizes more of our survival hormones like cortisol. And so in men, the low testosterone tends to be the most common problem as we get older. We call it andropause as well. And in females, again, like, it can be like, the estrogen levels can be too high. They can be out of balance. The testosterone can be low. Those are, again, the common hormones that at least we see disturbance with. In addition, you can have problems with your thyroid. There are other hormones at play, but I think these two are the most important, the estrogen and the testosterone.
Today we'll be performing another testosterone palette procedure. I'm a big fan of testosterone and overall hormone palettes because they provide a very steady levels of hormones over a couple of months. And the other benefit is that we are able to get the desired effect by giving much lower dose of testosterone. So today we are inserting testosterone pellets in a male client of ours who has low testosterone issues. Initially it was on injections, but the problem with injections is one, you have to give it every week. Two, because we are injecting in the skeletal muscle, there's a lot of blood supply, so we have to give a higher dose to get the desired response. In pellets, we can get the same response, same benefits of testosterone replacement therapy, but we are able to give about 80% less dosing over 6 months compared to injections. So that's why it's my preferred therapy. So the pellets come in like little vials like this. They're tiny, they're about the size of a rice grain. We anesthetize the skin with lidocaine, and the procedure takes 10 to 15 minutes. So let's go ahead and get started.
So we do need some supplementation from the outside. Now, it also depends a lot on the lifestyle. I mean, I can tell you that I have some 80 and 90-year-olds who still want to go, like, ride their bike for like 10 miles a day, and they don't want to slow down. And they absolutely hate it when the doctors tell them, well, you're just old, deal with it. Right? They don't want to feel old and they don't want to look old, and they want to stay active till the day they die. So naturally, for someone like that, they do need higher doses of hormones because, they want to maintain a very aggressive lifestyle. But someone who is not as aggressive, we use lower doses of hormones. So it is, everything we do is kind of personalized. So there's no cookie cutter approach. It all starts with a very thorough consultation. We do the appropriate testing. We figure out what the expectations are from the treatment, what lifestyle somebody's looking forward to. But generally, if your underlying glands are not healthy, people do need long-term hormone replacement. But now someone whose overall health is okay, but their body's just not making enough hormones, certainly there are like some supplements, some nutraceuticals and IV nutrition we can use to just let our own body produce more of these hormones. And then, of course, that does involve some lifestyle changes too. I mean, if you're sleeping like 2 hours a night, I can't really help you. So you do have to work with me to improve and make some changes in your overall lifestyle to help the body heal and the mind heal. It all goes in together. Just taking supplements is not going to help. Just doing a prescription is not going to help. It's kind of like a teamwork. The more we modify things, I think we have the best results.
One of the other treatments that you offer is the transgender hormone therapy. We're seeing more and more people that are going this direction. Can you just explain? This is a long process, so I want the audience to understand how long this process takes, and it's different for men and women. Can you just give us a little summary on that
Yeah,
treatment?
yes, sure. I mean, it's kind of a political hot potato, transgender hormone therapy, naturally. Not everyone is in favor of it, but again, we do support the community. And to me, someone who is older and over the age of 21 should be able to kind of make their own decisions. And I have seen, if your gender identity is not in sync with your brain, I mean, people have a lot of anxiety, they have a lot of depression if this is how they identify with. And we are all different. I mean, that's nature is very diverse. So
Mhm.
we do help facilitate the transition process. From somebody who wants to transition from male to female or female to male. But again, it involves having a thorough consultation. Then we do have them see like a counselor to make sure that all the other issues are addressed. We want to make sure that they understand the processes because again, this is a lifelong commitment. And when someone does
Mhm.
start the hormone, even if they later on decide, okay, this is not what I want, some of the effects do not go away. So we're very aware of them that people do understand that this is a choice. And if they go this path, there are some effects that are not reversible, even if they stop doing the hormone therapy. But generally it involves somebody who wants to transition to, let's say, female, and they're born as a male, biological male, naturally, we have to reduce their testosterone and increase their female hormones like estrogen. And then the other way around, if somebody is like born as a biological female, but later on decides to that they more identify as a male, we'll make sure that they are on high dose testosterone therapy, and we're using uh, medications to suppress the estrogen therapy. So that's pretty much how that works. The changes do take time. Typically, start seeing effects in about 6 months, but the changes do take about 3 to 4 years for the full effect of that hormone therapy. It's kind of creating a secondary puberty. Naturally, if
Mhm.
somebody's younger, they have better results. But I have patients who are like in their 60s, and they said, okay, finally, I feel like I'm ready to accept who really I am, and I want to do this. So it's everyone's different. I think we should be able to. We get to live once, and we should be able to live on the terms that we choose without interference from politicians. At least that's how I believe. It's our own life choices. But as long as you're making an informed decision, that's what we believe.
Yes, and thank you for clarifying that because and being thorough in making sure people are ready for that.
Okay, well, my experience at Healor started back in 2018. When I came to Healor, I had already had a really serious bout with what they call eosinophilia, which we didn't know what it was at the time. I was seeing one of the nurse practitioners here who sent me in for testing, and after having had 7 hospital visits and 4 intubations, the testing that nurse practitioner Tran at the time had done for me we discovered that I was an eosinophilic, and that's something which affects your white blood cells. And how that all happened was I was living in a home here that was infected with a fungus called Penicillium aspergillus, which almost killed me. And from that, we went on to learning the proper medications that would actually treat it. You see Fasenra on TV and that's what kind of keeps that in check. And it had been a very long bout during that time of just, I wasn't able to walk across the room without having to sit down because I couldn't breathe. So the tax that it put on somebody who was fairly active, really, it was pretty bad. So recovering, I recovered somewhat from that and kind of went right into my boyfriend, who here at the office, we found out that he had some very serious health issues with his heart. So that in turn put another very heavy stress on my life and handling with that and taking care of that. And fortunately, his nurse practitioner here, Mia, who has been taking care of him as well as me myself, has gotten him through all of that. And I just decided that this year it was time for me to take a look at myself and why I was just feeling as miserable and not motivated and overweight as I had been. I've struggled with overweightness all my life, binging, never purging, but always binging and eating whatever problem, anxiety, or stress I had. So I had come to a point where I just needed to get that stopped. At 65 years old, I just felt that there's two roads you could travel. You could travel the road to being a healthy, fit, older woman along the timeline, or you could travel the road of being a overweight woman with bad health. So I decided that this is kind of the final chance that I'm going to be able to do this, to readjust everything. So Mia ordered a myriad of blood work for me. And after looking at the blood work, we saw that we had quite a bit of work that had to be done along with adjusting my diet. And she has been a really amazing support. Been the beginning of a really good journey. And the journey's been going on now with this for about 5 weeks. And I've seen, with the help from Mia and the support on the medical side, along with my dedicating myself to exercising and being really conscious about what I'm putting into my body, I've achieved in the 5 weeks a 13-pound weight loss, which is a pretty, solid. It's not a swinging weight loss. And I just know it's a doable situation. And I think it's a matter of giving up everything that plagues you and letting it go and taking the hands of those who are willing to support you and support yourself, and just step down that path, and you'll be surprised of how you can make the change in your life that you really need to make. And Healor has been an amazing support for me in that path.
There's with technology and so many things, and you touched on stress more than once, because we do live in a stressful society and violence. And one of our goals of our show is to reduce the amount of violence that we see in and out of the home and for our youth. But is there any stress-related illnesses that you're seeing an increase in, or something that you're treating more than normal that may be on the rise?
Yeah, I mean, I think every illness is pretty much stress related these days. We're just living extremely stressful and extremely busy lives. There's lack of focus, and we just don't have the time to kind of unwind and actually be outdoors or be connect with nature. So it's just go, go, go all the time, and but social media doesn't help, and all this technology, constant stimulation to our brain, it does not help at all. So yeah, we're seeing again, more, I would say like a lot of relationship problems, for example. That's true. A lot of low self-esteem issue, especially because of all the Instagram and TikTok. So like, okay, I look old compared to everybody else on the Instagram. So there's issues with low self-esteem, marital problems. We're seeing a lot of issues with erectile dysfunction and sexual health. again, people are just overly stressed, and because of that, the body does not prioritize, the sexual side of things because it's just not focused on it. So we're seeing that a lot. Naturally, our food is extremely processed, so we're seeing a lot of nutritional problems, um, and a lot of obesity, and generally bone loss, just a lot of aging issues. Basically, our population is way less healthier now than it used to be, like, let's say 10 years ago. I think we just gone as a nation where our health definitely has kind of declined. The COVID did not help, and I think we saw a lot of mental health issues and behavioral issues, especially after the COVID. A lot of people were already stressed, and the trauma of dealing with the pandemic, I think, was just too much. So I think as a nation, we are unfortunately on the wrong path. They see a lot of problems related to stress and just not being addressed properly.
That's why we call our show Mental Margarita. It's about people finding their center and they're living their best life, being happy, finding that thing that brings you joy. And one thing that I read about you is you're a little bit of a thrill seeker when it comes to when you're not busy working and helping people live their best lives. Skydiving, scuba diving, horseback riding. Um,
Sure.
how did you pick up all of these? Did this happen when you came to Las Vegas, or
No, I've always been a little bit of adventure, but then again, I'm a physician. Like, we see so much death and we see so much trauma in our professional lives. And sometimes you become like a lot of numb to a lot of different things, because, we just see so many people die around us all the time. And it's just, it somehow it changes you. And then somehow you want to connect back with the real world, and doing these type of, skydiving or scuba, doing some of these adventure stuffs, get that adrenaline going, and, just makes you feel alive, kind of thing. So, and I think it's good for the health too. So, like a little bit of that stress, we all need that. So I do enjoy roller coasters and all of those things, and I push my body to kind of break out of its natural rhythm and routine. We tend to become, more risk averse as we get older, and I think we feel like we have more to lose as we get older. So I like to try to change that, and, just stay young and do adventure things, which I love to do.
we want the audience to try new things. It's never too late to venture out and try something you've never done. You're also a father of two. We have cats and dogs. There's fur babies in the house as well. So you're a lover of animals. We want to be here for the ones we love. And in balancing all of that, and thank you for addressing the fact that a doctor's life can be very stressful, and you do see much pain and suffering and death, and you have to find your way of coping and dealing with that.
Yes.
So, is there anything else any advice that you can give people to maybe find their center or find some peace, something, a little exercise that people can do quickly to calm themselves?
I think the most important thing, at least I feel, is like, it's okay to be flawed. It's okay to be imperfect. And I think we're all chasing that perfection, which is hard. But I think it's okay to, it's okay. I disappoint myself all the time. I am sometimes not able to keep up the promises that I make to myself. Like, I gotta work out every day or do this, this, this. So it's okay to, disappoint yourself, but again, start over, it's not a failure, So, and then I, like I said, we live very stressful lives, but every day I try to be a better version of myself. And I do think that compared to 10 years ago, I'm a better human being. I'm a better physician. I'm a better father. So I think it's just a matter of, continuously trying to get better. None of us are perfect. And as a physician, we deal with a lot, and, we're humans too. And, we just have a different level of experience that we do, but, uh, at the end, just learn to forgive yourself and just start over. And our health is our biggest asset. And I think people have this notion that, hey, I'm only going to go see my doctor when something is wrong with me. That's a wrong idea. So you should see your doctor regularly so we can catch up things earlier so that you do not have something wrong with you later on. And health is our biggest asset. And once we don't have it, we realize how important it is. So invest in your health, take good, high quality supplements. Don't buy the cheapest stuff you can buy. And you're putting something in your body, make sure it's well tested, it's made here in the US. And I think those will be some of my tips.
Well, thank you so much for sharing that with us. Healor.com, Healor.com. Is that the best way for people to reach you?
That is the best way. Yeah, I mean, we do offer virtual consultations, telemedications too. I mean, I have clients all over the US and abroad, so we do provide that service as well. You can always call our office or text us at 702-362-2273 as well. But website is generally the fastest way to get hold of us.
Wonderful. Well, we'll make sure everyone has the access and resource to find you and gain access to all those wonderful therapies and treatments. And thank you for taking the time to visit with us today, Dr. Singh, and all that you shared with us. And go see Dr. Singh, everybody, and make your appointment and make sure you're in tip-top shape.
Thank you so much for the opportunity. I appreciate it. Thank you.
Attention business owners, get your messages to Pahrump and Nye County by advertising with KNYE 95.1 FM, the big voice of Pahrump and Nye County. Call 775-537-6100. That's 775-537-6100. Give in to your mad cravings with a healthy bowl from Teriyaki Madness. Real food made to order, prepared with fresh, high-quality ingredients that make you feel like $1,000,000. Satisfy your cravings at these Southern Nevada locations in Pahrump and Henderson, where friendly staff is awaiting your visit. Experience the madness. Teriyaki Madness.
You're starstruck, here's a sprinkle of the stardust. Hold your champagne glass and your cigars up. See the guys with mob ties drive the cars up. Bright lights, most nights they buy the bars up. Candy coated Chevy cars on the highway. It's Frankie baby, it's on and this is my way. Dean Martin at the Sands this Friday. With Sammy Davis, here's a little hint where I stay. The city shines like Liberace's mansion. And you know Elvis had the whole city dancing. Showgirl silhouette steady prancing. Shout out to June, just the Copa Girls anthem. Legal gambling, yeah, that would tempt me. It's Sin City, holy water couldn't cleanse me. And Wayne